Hi, I'm Ange and I'm one of the nurse colposcopists at the Royal Women's Hospital. If you're watching this, you've probably been referred to have a colposcopy. You might be feeling nervous or have questions about this, so in this video I'll explain more about colposcopy, how to prepare for one and what to expect during and after the procedure. Our colposcopy clinic is called the Dysplasia Clinic and is located on the first floor of the Royal Women's Hospital. For details on how to get to the hospital, you can visit our website or call the Dysplasia Clinic. You will need a colposcopy if you've received a cervical screening test that indicates you might have cell changes in your cervix that need further treatment, or if you have any symptoms that your doctor wants us to investigate further. Most cervical cell changes are caused by a virus called HPV, or the human papillomavirus. HPV is a very common virus. In fact, about 8 out of 10 sexually active people will have an HPV infection in their lifetime. There's no treatment for HPV, and your body will normally clear the infection on its own. However, if your body can't clear the infection, HPV can cause changes to the cells in your cervix that, if left untreated, may become cancer. The good news is that if we find these cell changes early, they can usually be treated quickly and easily. Remember, having an abnormal cervical screening test result is very common, but developing cervical cancer is very rare. A colposcopy is a procedure that allows us to take a closer look at the cells in your cervix, vagina and vulva to identify any cell changes that may need treatment. To do that, we need a special microscope with a bright light called a colposcope. Before your colposcopy, it's important to let the clinic know if you're pregnant, avoid having sex or using tampons for at least 2 days before, and avoid using lubricants or creams in your vagina for at least 3 days before, unless otherwise prescribed. Colposcopy will usually take about 20 minutes on average, but the whole appointment will take longer. When it's time for your colposcopy, you'll be shown to a private room where you'll be asked to undress from your waist down. You'll be given a gown to cover yourself with, and you'll lie down on a special bed or chair. When you are ready, a doctor or nurse will insert a speculum into your vagina and use a colposcope to look closely at your cervix. They'll take a small sample of cells from your cervix with a small brush and paint some diluted medical vinegar and iodine onto the cervix to help them see the cells more clearly. You might feel a small stinging sensation when this happens. They might take some very small samples called biopsies for further tests in the lab. They'll let you know if they are going to do this. Most people will find a colposcopy a little bit uncomfortable, while some people might experience a small amount of pain. If you've had a biopsy taken, you may feel a small pinch or pain similar to a period cramp. It's important to talk to your doctor or nurse about pain relief before, during and after the procedure so that you are kept comfortable. After a colposcopy, you can carry on normal activities right away, but you might want to take the day to rest, especially if you've had a biopsy. You can usually drive yourself home after the appointment, but you may want a friend, family member or carer to bring you home if you feel more comfortable. After the colposcopy, you may experience a small amount of vaginal discharge or light bleeding for a few days. This is very normal. For at least 3 days or until your discharge goes away, you should avoid having sex, very rigorous exercise, having baths or swimming, and using tampons, creams or lubricants. It is very unlikely, but if you have a lot of bleeding, abdominal pain, or fever and chills, contact your doctor immediately. You'll usually receive your results in a few weeks, but the doctor or nurse might be able to tell you straight away if they've found anything unusual during your colposcopy. If your results are normal or show low-grade changes in your cervical cells, you'll likely need a follow-up cervical screening test in 12 months' time with your GP. If your results show high-grade cell changes, you'll need further treatment. It usually involves a very quick and easy procedure. For more information and support, you can talk to your colposcopy clinic or your local doctor or nurse. You can also speak to a specially trained nurse at Cancer Council Victoria's free and confidential information and support service by calling 13 11 20.